Well, actually, contrary to what people think, kidney stones are very, very common. Up to 1 in 10 to 1 in 12 people can get kidney stones. And in the vast majority of people, there isn't an underlying cause. However, there are certain medical conditions such as diabetes or being overweight, or conditions where you have high calcium levels can predispose to kidney stones. It can run in families, so there can be a familial tendency. It can be associated with patients who have some abnormality of their kidneys. They may have been born with a structurally abnormal kidney, a congenital abnormality, which affects the drainage of the kidney, and in turn that can predispose to kidney stones. But there are also some medications that can increase the risks. But aside from those factors, often there is nothing to be found, and there is a very strong dietary association with kidney stones, for example, not drinking enough water, having a high salt or high protein diet. They usually only tend to cause pain if they move. So when stones are sitting in the kidney, particularly if they're small, they can be completely silent because they're usually not causing any obstruction or movement. And often they're just picked up on a routine scan for another reason. Obviously, if a stone then decides to come out of the kidney and work its way down to the bladder and travel in the tube, which we call the ureter, the tube that drains the kidney to the bladder, that is a very, very painful condition. It's known as renal colic, and usually ends up with patients coming into the emergency department because the pain is so severe. So usually, yes, if a stone drops into the ureter, it can be painful. Some very small stones, if they're sitting in the kidney and not causing any pain or any block obstruction, they can actually just be monitored with periodic scans and reviews. So not all stones need treating. If they are sitting in the kidney but causing some symptoms, they can be treated with lithotripsy, which is a form of ultrasound treatment. It's non-invasive, it's outpatient. It essentially involves breaking the stone with some high amplitude ultrasound waves to shatter it into tiny fragments of dust, which the patient can then pass. Surgeries can become necessary, particularly so if it's a stone in the kidney that is causing some pain or symptoms and hasn't responded to the lithotripsy treatment, which is normally the first choice, or if it's not suitable for lithotripsy treatment due to its size, its position, or its shape, then you may need to have keyhole surgery, which involves putting cameras up into the kidney and lasering the stone with the patient under anaesthetic. Obviously, if the patient has what we referred to earlier as colic, where there's a stone traveling down the ureter tube, if it's causing pain or blockage, then often in that scenario, surgery is needed to remove the stone quickly to help the patient's pain and to remove the obstruction. So again, that would be what we call ureteroscopy, and going up with a fine telescope and lasering the stone from the inside. Yeah, definitely there are lifestyle changes that can be made. As I mentioned earlier, there is a strong association with diet. So we usually, if a patient has had a kidney stone, I do warn them that there could be a 30 to 50% recurrence rate over the next 5 to 10 years. In the absence of any risk factors, the only thing that can be modified is diet. So we usually advise plenty of water, drinking at least 2 to 3 litres of water a day. Low salt diet, trying to cut down on animal proteins such as red meat, trying to eat more white meat, fish, lots of fruit and vegetables, sometimes adding lemon juice to the water because that helps to increase the citrate content, which helps to protect against kidney stones. Losing weight, and in patients who are diabetic, ensuring that their diabetes are under control. So those are some of the lifestyle factors that patients can make.